right. Wonderful. Welcome, everyone. Thank you for being here, and I appreciate you taking the time. So we're going to go ahead and get started. Again, representatives, please do add your name in the chat so we can ensure you're captured for our roll call. As always, we'll start with a few updates that have happened over the past month since we met in October. So exciting updates to share on our specialty managed care plan, RFP, as well as an implementation plan that is now available for public input. The majority of our time today we'll spend celebrating where we've come in the past year and getting your feedback on how we continue to move forward as this working group into 2026. It's hard to believe that we're nearing the end of this year, and so as always, want to take a moment of reflection and to share a few key updates on our progress so far. So with that, we're going to go ahead and get started. We have gone through roll call here, so we can move to the next slide. I'm excited to share a few updates related to our specialty managed care plan. So as you'll see on the left, a quick reminder, what are we talking about here? This is the new managed care delivery system that we are held to as a state to create as part of our settlement agreement with the U.S. Department of Justice. Few important updates on this, or key kind of design elements of this. It's going to be a single plan that covers the full state. It will also cover all existing Medicaid benefits, so medical, behavioral health, pharmacy, and transportation services that are currently covered in the plans. It will also include the new benefits that we're developing, a lot of really robust care coordination models specific to youth with behavioral health needs, and really intended to be this very specialty plan for this population. What's exciting is, unless another state moves even faster than we are, when this goes live on January 1st, 2027, Nevada will be the first state in the country to launch a plan exactly of these specifications. So other states have approached this without it being a fully integrated set. Other states have approached this just for their foster care population, but I'm really thrilled for us to be launching what is a really Nevada-specific model that meets the needs of our state and of our community. So I know for those of us that have been along for the full journey of our working group, this is not new news, but the exciting part, an exciting update here is that our request for proposals has launched. So this is published on our Nevada ePro, our purchasing website. This is managed through the Nevada's Division of Purchasing. And it includes a lot of really important information. It includes detail on the goals of the program and requirements for bidders in a more general sense in that request for proposals. It also includes a scope of work, which is, I believe it ended up being around 250 pages, almost 300 pages, that details really in very clear detail the plan responsibilities, performance standards, care coordination tiers. There's a lot of important detail in there. So whether you're interested in bidding on the plan or you're a member of the community that's just interested, that is available publicly on the purchasing website. And so if you are trying to get a hold of that or find where that is, you can always go to our Children's Behavioral Health website. It's linked right there on that main screen. And I'll ask someone on my team to drop a link to our Kids Behavioral Health website in the chat when they get a chance. So excited to share that update. If you want to move to the next slide, a few things I want to call out for this group. Firstly, there are 3 goals of this plan. The good news is that hopefully this feels pretty familiar to you all, but first is ultimately, we're here to improve the physical and behavioral health outcomes for children and youth enrolled in this plan. That's fundamental. We recognize that this system we are not seeing the clinical outcomes that we want to see from our system. And so this is a new delivery model that is intended to really incentivize those clinical outcomes that we want to see. Secondly, the plan is intended to really support enrollees that are living at home with their family or caregiver in their communities. This aligns really closely with our Children's Behavioral Health Settlement Agreement and the overall goals here, but it's really crucial for us to be able to align the goals of the specialty plan with the goals of that agreement. So that's what you'll see reflected there. And then lastly, there are a number of really detailed items in our scope of work that you'll see reminiscent of that settlement agreement because this is a key component of the state's overall transformation. Why those may be familiar to most of the folks on the call is that these are not new goals, right? This is things that we have landed on based on your feedback over the past year, based on our Youth and Family Summit and other public forums where we've had these conversations, and also through a request for public comment. So as a reminder, last month we shared the results of that feedback period at our October meeting, and so those are available now on our website if you're interested in learning more about what feedback we got and incorporated in those planning materials. If you'll move to the next slide here, I just want to share a little bit more about the timeline. So as a reminder, all dates for the RFP are tentative and subject to change. So definitely recommend folks refer to those procurement documents and materials on the ePro website for all official communications on these dates. But at a high level, again, the RFP was published last week in early November. We're in an ongoing Q&A period for bidders. Bids will be due on January 6th of this year. We'll go through a pretty robust evaluation process throughout the month of January. We have folks represented in our evaluation committee from all of our key partners in the system, sister agencies, county partners, and community partners as well. So I'm really looking forward to their input and also thankful for our working group co-chairs input through this evaluation process as well. The intent is for an awardee to be selected and contracted by April of 2026 in preparation for a May 2026 Board of Examiners approval. That, again, is Nevada's process for confirming any sort of overall contract. And that's really intended to allow for a lengthy go-live preparation process. This is a new plan to the market, and we recognize this will take time for us to be able to develop this new product and support both the bidder that is selected as well as all of our providers in preparing for this new delivery system. So we will spend a lot of time working with this working group on all the details of this implementation and preparation process, and I'm really looking forward to the group's input on this. And again, that's all in preparation for a January 1st, 2027 go live. So if you go to the next slide, as a reminder, any questions related to the procurement should be sent to our purchasing division. They handle all questions related to this through our Q&A process. So our colleague that's running that process in purchasing, her name's Heather Moon. Her email is listed there if you have any questions. For general information or opportunities to provide feedback as we prepare for this implementation process, as always, please go to our website. There you can sign up for our listserv, which hopefully everyone on this call is there, and also for other information related to public workshops and other meetings that will inform key aspects of this plan. So with that, we'll move to our next update, but want to thank you all again for your hard work and progress. We would not be here at a key milestone of this work, as I shared over our listserv last week, without your input, and I'm deeply grateful for it. For those that have time to read through that scope of work, I hope you see that feedback really clearly reflected, and we look forward to your continued input as we move into this new delivery system model. So with that, I'm going to shift gears a little bit and talk about something related to our Department of Justice settlement agreement process. So if you move to the next slide, this is a little bit of a busy timeline, but this is something that we have pulled together to really reflect all of the various requirements within the settlement agreement tied to public reporting, tied to overall program management, as well as the ways that we work with our Department of Justice colleagues and our independent review team. So you'll see we're here in the Q3, Q4 time period. We have been in the process of drafting and getting feedback from the Department of Justice and the independent reviewer on our implementation plan since August of this year. And so we're really thrilled to be able to share with you all what is a kind of a final draft version of this plan that we want your input on. So the intent of the implementation plan, if you move to the next slide, is really to detail at a high level the timeline and summary of what are we doing to achieve compliance with the settlement agreement, and then line by line with each item in that settlement agreement, talk about exactly what the state will do and how that will, when that will happen and how that will be measured. There's a lot of information in there, and we also recognize there's a lot of details that we are still going to be fleshing out with this group. And so we'd love your feedback on what's currently listed. If you have questions or things that you'd like us to clarify, or things that you'd like that you're seeing in the plan that you'd like to bring to this working group, we'd love to hear it. So this transformation plan is linked on our website. So again, the kids behavioral health link, which thank you to my colleague Debbie, who has listed that below. Take a look at that, take a look at the implementation plan there, and share your feedback with us. We're asking for your feedback by December 11th, so just about a month from now. That will allow us to be able to process that feedback, finalize the implementation plan, and get that posted publicly by the end of the year. So I'll pause there. Are there any questions related to the implementation plan or items folks would like to flag before we move forward? Right.
And this is Karen.
Yeah, go ahead, Karen.
So you mentioned that you've been working with the DOJ. Is there a DOJ representative assigned to this?
To our project? Yes, there is. So we do have colleagues at the Department of Justice that we've been working with throughout the course of this agreement. They have been furloughed throughout the government shutdown, but I actually just received an email from them this afternoon as they're back in the office today, which is exciting. So we've been meeting with the Department of Justice on a monthly basis with our independent reviewer, as required by the settlement agreement, since January of this year. And so those will continue throughout the course of the agreement.
Great. I just was curious if they had been paying attention to Nevada.
Yes. Oh, absolutely. I've been really appreciative. They provided very detailed feedback on this implementation plan and through a line by line kind of redlining and editing on it. So a lot of
Thank
good
you.
feedback and input there. Yeah, absolutely. Any other questions on the implementation plan part of this work? All right. And forgive me if there's a little background noise from folks that joined a little later. I'm coming to you live from our legislative building as we're here with a special session today. And so it's a little bit loud. So again, please don't hesitate to ask me to repeat something or pop something in the chat if you're having trouble hearing me here. But thank you for your patience. So let's plan to move forward to the exciting updates for today, which is really to talk about our wins from 2025 and where we're headed in 2026. So if you move to the next slide here, we have met 10 times as a working group since October of 2024. And I know for me personally, October 2024 feels like a lifetime ago. And I really enjoyed working with our team to pull together this list of what are all the things that we've covered in that time since. So for those that have been along since the beginning, thank you. That's 10 hours of your life that you've spent with us, and I'm deeply grateful. For those that have joined us more recently, this is hopefully a helpful summary of the key topics that we've covered. So even before the settlement agreement was signed, we provided an overview of the state's transformation approach. In December, we talked about our Medicaid benefits and gave a summary on the data front of the folks that we're trying to serve here. In January, the day after the settlement agreement was signed, we actually got to present exactly what was in that, which was exciting. March was really spent, our spring was really spent on these key policy and benefits changes. So family peer support, our psychiatric residential treatment facility, incentive payments and policy updates, and our youth peer support services. All three of those items directly informed the policy updates, and we'll talk about that in a second, but those are really crucial for a lot of work that was finalized in late spring, early summer, which is excellent. This summer, we've talked a little bit more about the system, kind of at a high level. How are we developing screening and assessment tools as part of this overall transformation? And then we talked about baseline data and what data are we seeing on our focus population to date, and how can that really key us into the work that's needed moving forward. We also talked about respite care and got a lot of excellent feedback on how we can design a benefit and Medicaid coverage that aligns with services that are happening in our Nevada community right now. And I'm really grateful for the respite providers, as well as the family peer and youth peer providers, PRTF providers that have given really excellent feedback on their experience to inform those policy changes throughout this year. August and October, again, September was our Family and Youth Summit. This fall was really spent informing how should our care coordination model look and feel within the specialty plan. This is a crucial component of the specialty plan work and our transformation more generally, which is a local regional approach to care management for kids that is specific to their behavioral health needs and that level of acuity. And so I want to thank everyone who has given us feedback from a provider perspective and from a youth and family perspective of folks that have gone through various care coordination models in our state and helped us really learn how best we can develop this in the model moving forward. So that's kind of a snapshot of what we've covered. In addition to the working group, our team has been quite busy incorporating that feedback and reflecting that in a lot of the work that we've been doing. So I want to share a few updates on the work that we've done in 3 different categories. So that first category is going to be related to community engagement. So this is my favorite part of our work, which is really saying, how can we kind of demystify, open the black box of this Medicaid transformation and get your feedback and really try to better understand how we can ensure that what we land on over the course of the coming years actually addresses the concerns and needs of our Nevada community of youth and families and of providers as well. So in order to do that, we have launched this group, which is reflective of all folks across that spectrum and an excellent group of members of our community that just join us and stick around every month, which I'm so grateful for. We also had a youth and family deep dive or kind of summit to discuss care coordination based on their lived experience with the system. was a really meaningful afternoon, and we got to some excellent feedback thanks to the hard work of our co-chair and our youth representative, Brenna. So I'm really grateful for Jessica and Brenna's hard work to bring the insights from across our full state and a number of different forums that already exist to really ensure that we're hearing from all the voices that we need to throughout this process. We also spent a lot of time on the road. I got to travel across the state to meet with county partners and tribal partners. Down below is an event we had in Elko last spring, or last fall, excuse me, where I got to meet with some mobile crisis teams and respite providers out there. We also participated in a youth mental health summit, and I also want to shout out Jessica and Brenna for their excellent work there. It's been wonderful to get to know folks and see a lot of familiar faces in each of these events and really get meaningful feedback. I've been deeply appreciative of the way folks have given me honest and really clear items that Medicaid can support with and do better on. So I want to thank you for that, and thank you for trusting us with that feedback, and also ask that it keeps on coming. So please don't hesitate to reach out as things come to you, and know that this is a really core component of this process for us. I think it's the most foundational one, and that's why we're starting with it. So I'm really grateful for that work. If you move to the next slide, the next kind of bucket that I want to talk through is on the benefits coverage side. So again, in Medicaid speak, benefits coverage means, what do we as a state insurance company, whether it's us paying the bill or a managed care organization paying the bill, what types of services will we pay for? How do we pay for it? And which types of providers do we pay to do these services? We've made a ton of progress in this area over the past year, which I'm really proud of. And there's a lot of big changes that I'm hopeful will be coming very soon, as soon as we receive approval from our federal partners at the Center for Medicare and Medicaid Services. So a few of those key wins: we have family and youth peer support services as a covered service now in the Medicaid plan, which is excellent and a wonderful step forward. I'm grateful to our teams that are working through that provider enrollment process now, which we recognize is a pretty lengthy one. And so we look forward to hearing their feedback throughout. The two big pieces with CMS that I know are of key interest to everyone on this call is a comprehensive set of rate increases and reform for outpatient behavioral health services, as well as for our psychiatric residential treatment facilities and inpatient psychiatric hospitals. This is a crucial component of the work, the services that we already pay for, but perhaps not to the level that is aligned with the cost of delivering care. And so I really look forward to receiving that federal update. Know that we're working on almost a daily basis with our CMS team. These folks were not furloughed during the government shutdown, so we've been able to keep that work really in that momentum going. And so I look forward to sharing updates with you all as soon as we have them on that front. I'm getting to meet with all the CMS folks in DC next week for a Medicaid conference, so I will be bugging them about this first and foremost, I can assure you that. So look forward to updates soon. The pieces that are still under development are the ones that will really align with the launch of our specialty plan. So respite care, intensive care coordination, and wraparound care are the three kind of remaining benefits that we are seeking federal approval to cover. And stay tuned, because we'll be talking about a lot of these in our working group in 2026. We want your feedback. I'm grateful for all that we've gotten so far. And so we look forward to sharing with you drafts of what that policy looks like, what the provider requirements will look like, what the rate details will look like. All of those components will be coming in the coming year as we prepare for a 1/1/27 go live. The last piece, perhaps one of the less interesting on paper ones, but super crucial, and I know near and dear to the hearts of all of our providers, is related to how do we improve consistency of how we pay for services across provider types, and also align supervision standards in a more clear way. So we've been going through a process. Our behavioral health benefits coverage team has been hard at work to ensure that our policy best reflects our state goals and the work that we're trying to do here, and make that process a bit easier. So know that the administrative burden and clarity of our work is a key priority for us, and we look forward to your feedback on how we can continue to make that better. I want to highlight on that blue box here, here's some quotes that we got from you all, whether in written comment or in these meetings. I'm grateful to our team for assembling these, and I hope that you all see your words reflected in this. But I want to make sure that we can really allow these to sink in, so I'm going to read them if you can bear with me. So on the youth peer support piece, we heard from a community partner, youth want peer support available earlier, not only after a crisis. It's a part of prevention. On family peer support, we heard from you all, peer support should be integrated into care teams from the start. This is a crucial part of our child and family teams, and we're deeply grateful for our family peer support providers who are doing that right now. On the care coordination front, we have oodles of quotes on this because we have a lot of excellent feedback that was reflected in our scope of work and also will be reflected in our care coordination policy. You can read a full rundown of what that looks like in our Youth and Family Summit summary document available on our website, but a few key quotes I would want to call out here. First is, one child, one care coordinator. Families cannot tell their story 5 different times. Wraparound works when caseloads are manageable and family voice drives the plan. And lastly, coordination fails when systems don't talk. The model must require cross-system information sharing. These are key themes, and I hope are likely not any surprises to anyone here, but I'm really, it's very important to us that those are very clearly reflected because these are guideposts for how we're moving forward with our policy design. You want to move to the next slide. Our next key bucket is on the delivery system. And again, trying to demystify that Medicaid speak, what that means is delivery system is who is paying for the services that someone is receiving through Medicaid. So we have 2 types of delivery systems in Nevada. As a reminder, our fee-for-service program, in which the state Medicaid name is on an insurance card. We also have a managed care delivery system, in which a managed care organization contracted with the state is that delivery system for you. So again, our specialty plan will be kind of a third flavor or kind of a sub-flavor of managed care that will come into play. So this is really focused on that specialty plan. As we talked about, we conducted a really robust community input process throughout this full year on how to best design this plan. We integrated that into our materials and our plan design. And we really tried to emphasize throughout the scope of work and the service design, how integrated care and youth and family voice should best be reflected. You'll see something like a youth and family advisory council that will be part of the specialty plan that's required to give input on key policy decisions and to review key components of the specialty plans organization. That is the direct input that we heard from you all, and I'm really grateful for it. We also heard some good feedback related to community reinvestment, which is about how do we require as a state that any profits earned by the managed care organizations are reinvested back into our community. So a few key quotes on that piece I wanted to share. Any managed care plan serving these children must reinvest in community capacity, not just pay claims. Rural communities expect the specialty managed care plan to help build workforce and provider capacity, not wait years. Lastly, reinvestment must be part of the contract, not an optional add-on. You'll see that it is part of the contract, and I'm grateful for all the feedback on exactly how that should look. Additionally, system capacity and equity was a key theme we heard from you all related to this delivery system change. So we heard plans should be judged on outcomes and reinvestment, not utilization management alone. Community reinvestment should support peer networks, respite, and culturally responsive providers. Lastly, reinvestment should reflect local partnerships with counties and tribal entities. You'll see things reflected in our scope of work, such as requiring a tribal liaison to be hired by the plan to utilize and really better build these partnerships with our tribal communities. Additionally, you'll see key details on community reinvestment, but also requirements for quality of care assurance related to culturally responsive care and trauma-informed care to ensure that our providers in the network really meet those standards that we all believe are crucial to ensure clinical success for our kids. So I want to thank everyone for their input on this plan, and again, look forward to your feedback on how you see that reflected in that scope of work. The next piece and last bucket here that I want to talk through is compliance. Perhaps maybe one of the least interesting but super crucial components of this, and something that I know we all care deeply about, which is how do we ensure transparency and clarity in data and reporting on the state's path to compliance with the settlement agreement, and also just our transformation work overall. So we've developed our baseline data report that really aligns with our internal quarterly reporting, as well as public dashboards that we're excited to begin in January of 2026 in alignment with that settlement agreement timeline. In order to do that, though, we had to do a lot of back-end work with our county partners and sister agencies to ensure that we can share data that historically we have not been. And that's a really crucial component to ensure we can reflect data on the foster care system, on the juvenile justice system, on mobile crisis response in Washoe County. I'm deeply grateful for the teams that have been working hard on that to ensure we have a more complete picture of this population that we're serving. We already talked about what that draft implementation plan looks like. And as I also mentioned, we have ongoing quality and compliance review meetings. Again, monthly meeting with the Department of Justice team and our independent reviewer team. We also have our regular meetings with sister agency administrators, which are our quality review meetings, to go over our path towards compliance and key areas of really interdisciplinary or interagency action needed. So grateful that those things are all reflected in the feedback we've heard from you, including the biggest barrier is inconsistency across counties in sharing crisis and assessment data. And we'll acknowledge this is a key challenge, and I know something our county partners are equally excited to solve for. So we have 2 full-time staff members within our Office of Analytics here at the state that are dedicated to the children's behavioral health transformation. And they've been hard at work with our county partners to figure out how we can establish those data sharing agreements and better clarify how we will communicate proactively data across all of these key areas to better kind of put together the puzzle pieces in this data picture. That transparency is crucial, and we heard that from you all as well. Families should not have to guess whether Nevada is meeting its timelines. Transparency is part of compliance. So really grateful for that piece and know that that's a key aspect of our commitment throughout this transformation. Again, the transparency on our baseline data report and the implementation plan is key. I'm thrilled for you all to take a look at this public dashboard once that's available soon. But we'd love your feedback. If there's other areas that you feel further transparency would help or be valuable for your work or your perspective and feedback, we'd love to hear it. So as always, please share that feedback with myself, with our Children's Behavioral Health Inbox, because we want to ensure we're really rising to that occasion and being as clear as we can in this work. So if we'll move to the next slide here, I want to thank you for listening to me through all these topics. I know that's a lot of key accomplishments, but I hope you all can take a moment to celebrate because it's an incredible amount of work that's happened over this past year, and we truly could not have done it without this group support. So before we open it up for discussion, I want to share a little bit more about what we're thinking about for 2026. Within those 4 categories of community engagement, benefits, delivery system, and compliance, what are the key priorities for this group? So what you'll see here reflected is a couple kind of initial priorities of the state, but we want to build this out based on your feedback. And so that's really what our discussion will be today. I want to share with you a little bit more about what these look like at a high level, and then I will open it up to this group. So on the community engagement front, these working groups will continue. We're going to get your feedback on how to make them as valuable as possible in this next kind of phase of our work. But we're deeply committed to continuing to gather input from this really excellent group of minds and to come up with new and even more creative ways of best engaging, particularly our youth and family partners. We recognize that these types of forums are not always the most direct or most comfortable spaces for folks to share what can be really challenging or vulnerable life experiences. And so we look forward to continuing to learn from feedback from this group on how we can tap into existing conversations that are happening in our communities and just gather whatever feedback you all are willing to share to inform this work. We're also launching a new webpage, which I'm excited about, that as I mentioned, we'll have these deliverables related to the data dashboard, and we'll also have more interactive visuals related to this implementation plan and progress towards compliance, so stay tuned for that. We also, as I mentioned, youth and family co-facilitation across all of our work, really crucial for that as well. On the benefits front, I'm excited for the final 3 benefits to be approved for intensive care coordination, wraparound, and respite. Again, that will be a process we're going through with our federal partners throughout 2026, and so look forward to sharing more as we hear from them about the timeline there. On the rate reform side, a key benefit, I'm hopeful this will even happen in 2025, but it's still a key priority for 2026, is ensuring that the system implementation and any sort of claims recycling is as smooth as possible for our providers related to those rate changes. We recognize that's a crucial detail in this process, and just because we get the thumbs up from CMS doesn't mean we're 100% live. So I look forward to working with this group and sharing information as soon as we have it on that process, and know that we've worked hard to update all of our systems on the back end so we can turn that switch on as quickly as possible. On the delivery system side, again, this is the biggest area of work right now, selecting and contracting with that specialty managed care plan vendor. Once that's done, we're going to go through a really comprehensive readiness review in which we have an external partner come in and assess the plan's preparedness and readiness to achieve our contract goals. So that will be ongoing throughout next year, and we'll get feedback from this group on key areas for that quality review organization to take a look at. And more generally, we recognize just because we change the delivery system or the name on the card doesn't mean that our provider network doesn't appear instantly overnight either. It takes really thoughtful and concentrated effort to ensure that we have providers to work in this network, that the care coordination model is really successful and local in its approach, and that we're paying for the quality services that we need. So a lot of work to come on that front. Compliance side, our path is really charted by the settlement agreement. So quarterly data reports, public facing dashboard, again, continuing to improve what data we have and how it's published and shared, and working very closely with our DOJ and independent reviewer partners throughout that process. So let's move to the next slide. I believe it's our discussion question. Wonderful. So I get to go on mute so that way we can hear from you all. Firstly, any reactions on those key accomplishments, something that you're proud of that you didn't see reflected but would like to? We want to make sure that's celebrated as well. But also, how do we inform 2026 and those key areas? And what things would you like to see reflected there? Are there other transformation initiatives that you want to learn more about or provide feedback on in the coming year that we should add to the list? Now's a great time to share that with us. We're really organizing what they all look like in the coming months and want to make sure that's reflective of what you want to see. And then the last question is, what types of topics or formats best support your participation in this forum? We recognize this is a huge ask of your time to join in the evenings and to join virtually. And I'm so grateful for all the folks that do every month. But we want to make it as useful as possible. So if you have feedback for us, we'd love to hear it. We will have an opportunity for representatives to vote on what this looks like in a second, but this is again an open discussion and we look forward to hearing from you all. So with that, I will pause and go on mute and look forward to hearing folks' initial thoughts and reactions to this. I do see, I'm just seeing a comment in the chat here, so we'll start with that. And then again, look forward to feedback from the group. If you want to raise your hand or come off mute, you're welcome to as well. But Grace, want to thank you for your question. Does the data dashboard overlap with the Nevada all-payer claims database? Great question. So for folks that may not be as familiar, the all-payer claims database is an effort that the Nevada Health Authority is undergoing to assemble anonymized claims data beyond just Medicaid, but across all payers to better inform our providers and community members' understanding of our Nevada healthcare landscape. I do hope that we can include APCD data in this long term. The data dashboard requirements are really specific to our Medicaid program, which we do have claims data on, but I think it would be helpful for us to get that clear picture of non-Medicaid service utilization as well to inform, particularly on our provider landscape. Where are we at in terms of provider capacity and how can we continue to improve that across regardless of who's paying for someone's insurance? So Grace, I welcome feedback if there's something specifically that you would love to see in that APCD data in our data dashboard. We'd love to hear it. But given the timeline of that being stood up, the first version of the dashboard will be included, will just reflect Medicaid claims data to start, as well as that county and other state data input. Is that helpful? And Dana, seeing your piece, would be great to capture school health services in the dashboard. Yes, there's a lot of work. We have a lot of dashboards, as you guys probably know. So there's a lot of work to figure out how do we assemble them or align them where they may actually overlap. And there's a lot of excellent reporting that our school health services team is doing related to the grant work there. So that's a good suggestion and something we can take back to our data team as well to figure out how can we link those and reflect particularly the behavioral health services that kids are getting in schools in this overall dashboard. So thank you for that suggestion. Great. Diane, I'm seeing your hand up. Go ahead.
Hi, thank you. On one of your very first slides, when you were highlighting the priorities, there was something about serving children and youth who are living at home. I want to really make sure. I found the use of your verbs there interesting. Who are living at home. I want to make sure that we are not forgetting those who can't live at home because our current system of care does not provide the infrastructure needed for them to be able to remain at home. Really staying true to that Olmsted the Olmsted law, requirement that we serve these children and youth in their communities of choice. And so that just kind of popped out at me.
Thank you for that feedback, Diane. That's a great point. And that may also just be the way that I have described it or represented it on the slide, because I think the intent and goal of the plan is exactly aligned with what you've shared, which is to say, for kids that are in a home and community setting with their family, whether biological or foster adoptive, that they're able to stay there. And for kids that are not currently able to, how can we help them, with a path towards achieving, to your point, life within whatever setting that is best for their clinical needs and their priorities and goals. So thank you for that feedback. I'll make sure that that's really clearly reflected in how we talk about this, because I want to make sure that our shared goal is very crisp and clear, because that's 100% aligned. And I hope you'll see that in the RFP and scope of work, those pieces are really clear and intended to be in that broadest manner if possible, in terms of helping stay and also remain or get back to a home and community setting. So thank you for that great call out. Thank you. I'll take Donna's question in the chat, and then Karen, I'll turn to you. Is there anticipated date and time for the screening summit? Yes, great question. And something that we will be sharing more about in just a few slides, actually. So instead of our December working group meeting, there will be a provider summit related to the screening tool process that our clinical advisor, Dr. Christine Pebbles, will be leading. There is a survey that will get feedback from our provider community on exactly what day and time works best. I recognize you all are incredibly busy and clinical schedules are not easy to schedule around. And so we want to work around your schedule, and that's what we'll be asking for your feedback on. So we'll share the link to that survey in our follow-up materials, and we'll talk about that more in a second. But thank you, Donna, for asking, and we'd love to have you and anyone who's interested in that screening tool conversation there. Thank you. Karen.
Yeah, so the Clark County Consortium has been looking at data related to 911 and mobile crisis, and it's been important to look at age groupings by service and diagnosis. And I wanted to ask if you have that planned for your data dashboard.
Yeah, great question. And I would love to see too, I know some of our state colleagues attend those meetings, but if you'd be willing to share whatever data once it's publicly available from your work, we'd love to learn from that. But yes, the way that our baseline data is reported and the way our public dashboard will be reported will include age groupings. And I'll have our data team, my colleague Mallory and a few others on the call may be able to chime in either live here or in the chat with what those age groupings are right now. I don't have those off the top of my head, but really trying to ensure that we reflect the nuances of our populations in this, and treating children and young adults as a monolith is absolutely not accurate in terms of our data. And so how do we best really share what that looks like in a more subpopulation level? So we've broken it down by age and by geographic location in the state as well. But we welcome feedback if there's kind of other views or lenses on the data that would be helpful to you all, because that's something our data team is actively working on.
Great.
Thank you. Great question. Maybe we can go back one slide to show what these kind of 2026 priorities from the state's perspective look like. And I would welcome feedback. Do these sit right with you all? Are there items that you feel like we could add to the list or try to or better clarify on this list? We'd love your feedback there. Sorry, Melanie, can we go back one slide just so folks can take a look at that? I know I went through it probably pretty quickly. There we go, perfect. So yeah, within these 4 categories, any feedback, initial reactions here? There's no way we got it 100% right, but I would be thrilled. I'm seeing some smiles and nods, so I'm glad to see that. But anything else that you wouldn't want to see, or you're curious about how the state is approaching or would want to provide input on? Well, I am glad to hear that generally it seems like this does align well. And I also recognize our worlds here in the state and with our specialty plan program, they change very quickly. So know that we will continue to take a close look at this and ensure it's really reflective of what we need and how we continue to collaborate and communicate together. So a lot more to come on each of these fronts and likely things that aren't even listed here. So please don't hesitate to give that feedback as we continue to move forward. Yeah, Karen.
Yes, on the independent reviewer, I know you introduced us to him at one meeting. Is it still Tim Marshall?
Yeah, Tim Marshall is our independent reviewer. I'm not sure if he was able to join this call, but he's supported by a team at the University of Connecticut Innovations Institute as well. So we'll look forward to having their continued input through all of this. Know that each and every one of our policy changes, our state plan changes, so the federal work and the state work, all of that is run by Tim and our independent review team. They also provide us technical assistance. So while they may be more in the background in these meetings, and Deborah, great to see you chime in the chat here. Thank you for joining us. They're really supportive of each of kind of these steps of the process and helping ensure we're getting it right based on national best practices and clinical best practices. So deeply grateful for their work and collaboration here.
I just
Deborah, thanks for being here.
wonder if there's an opportunity in 2026 for them to engage with stakeholders or for them to bring their work to us.
Yes, absolutely. Yeah, so a couple ideas on that front, and would love to, Deborah, if there's anything else you want to add, feel free to chime in. Firstly, Tim and team have been working hard on the review plan. That's part of that settlement agreement timeline that you guys probably saw screenshotted on that slide. And so that's really dependent on us finalizing our implementation plan. These are kind of interconnected documents, but once the review plan is finalized, that's something that they will share publicly as well. And I know it's a key priority for Deborah and team to actually make a trip out to Nevada, which we're excited for, to meet with stakeholders and get a lay of the land out here as well. So that is definitely a key piece of our 2026 plans, and look forward to that continuing. So more to come on that front. And if you're interested in chatting with our independent reviewer team and engaging with that, we'd welcome that, and we'll share more detail on how to do that moving forward. But Deborah, anything else you'd want to add there?
Just that in this coming year, the quality service review process, the QSR process, and the larger compliance monitoring really kicks off. And so there will be various outreach to stakeholder groups as part of the information gathering process for that, which is going to go over a period of time. The actual approach to that is still being designed. But we are here and working as a team and in regular communication with Anne and her team, and we were with DOJ, and looking forward to having them back. So deep in it with them, and I think really we're really seeing the work really take off, and so there's a lot to dig into. But always welcome folks outreaching if they want to connect. And as Anne said, we're going to have some more materials to share coming soon.
Great. Thank you, Deborah. I appreciate it. Any other areas of feedback before we move forward? Right. So if we move to the next slide, or the one after our discussion slide, what we're really excited about too, as I kind of previewed, there we go, exactly. So we want to ensure that the way that we are using these meetings best aligns with what works best for you all. So we are asking our representatives to give us your input. We have a couple options that we're weighing internally with the state. One is to continue with this monthly hour-long current structure. So continue to do these each month for this virtual time slot. The other option is to actually lengthen the meetings, but have them every other month instead of monthly, and then have more ad hoc or small group sessions related to specific topics that may be more of interest to certain kind of smaller groups within this broader forum. So these are the two primary ideas we've had. I've had a lot of good conversations with folks at other states that have on their stakeholdering approach and how they've engaged with their community partners, and they've recommended both. And I've really enjoyed the way we've done it so far, but we recognize there's always value in trying to continually improve and reflect on this. So we welcome feedback through a quick little anonymous survey. I'll ask my team to drop the link in the chat if they're able to. We will also send this in our follow-up email materials as well. So if you want to think on it and spend some time We'd love your feedback by next Friday so we can make a decision for what 2026 moving forward will look like. So Dana, I appreciate your comment in the chat here. Again, we're trying to just get this right and make it most meaningful to you all. And we recognize your time is a gift to us and we want to use it wisely. So again, welcome any feedback on how to best use this group moving forward, and feel free to share that here through our email address or through that form as well. Great. So let's move to the next slide. A preview of where we're going, where we've come from and where we're going. So let's move to the next final slide here. Again, I want to thank you. I think I'm feeling a lot of gratitude this month. I was sharing with our broader Medicaid team, Thanksgiving is my favorite holiday of the year. So I'm in a very reflective mood. And as you can see here, there's a lot to be proud of. And I'm just really grateful for the input that you've provided us and also the trust. We recognize so many people have been working incredibly hard and made a lot of important progress in this world of children's behavioral health in the state for a long time. This is not new, but we recognize we have a really unique moment to utilize our Medicaid program and our Medicaid platform to try to transform some of the ways that we pay for and deliver these services to kids in our state. And so I want to thank you for trusting us through this process. And I want to thank you for staying on board as we move to the next phase of the ride. So we will be reconvening in January, like I shared. Our December meeting will be really replaced by that provider screening tool summit conversation. So that's why we'll reconvene in the new year. So as a reminder, please share your feedback on the implementation plan by December 11th. If you have feedback on how we have these meetings the next year, we'd love to hear it. So please share that through the voting form, which we'll share shortly. But overall, just want to express my gratitude and appreciation. And in that spirit, I also want to share a special thanks with one of our colleagues, Melorine Mulcree, who you've probably seen sharing screens and responding to comments and sending emails. She's moving on to her next adventure and role in this work. And we will deeply miss her, but we're really proud of all that she's done and grateful for the really wise eye she's lended to all of our work with community partners. She cares so deeply about how we communicate it and making sure this process is clear and communicative. So just want to shout out to Melorine and thank her for her work, and please join me in wishing her well for this next adventure. And with that, we will continue to move forward. So if you want to move to the next slide. Oh, sorry, seeing 2 hands up. We will not move forward quite yet. Thank you. I believe we had, I can't see which order. So Karen, do you want to go first?
No, I was trying to react.
Oh, no worries. No worries.
And thank Melorine.
Wonderful. Well, I appreciate that too. I believe there may be someone else's hand up, but I'm having trouble seeing a name. So if you have your hand up, please feel free. Oh, Megan, would you please come off mute and share any feedback you have here?
Hi, this is Janelle Hoover. I'm actually on Megan's account. We're together at this point. I just wanted to say thank you as well. I wanted to chime in really quick because you were talking about the Community Alliance and all the things that we're doing in the community, and wanted to just share with this group, and I hope that I'm sharing in the right opportunity time, but with the help from the state, Carson Tahoe has just opened 2 days ago our crisis stabilization unit for youth. So that's ages 12 to 17. And that came with grant money from the state and the ability to work with you and your team and all of the teams to be able to provide this opportunity. And so my very first meeting when we all got together, I was just overwhelmed by hearing so many people talk about the lack of availability of resources and of things that for our youth. And so I just wanted to be able to share with everybody that that is now open. It's 24/7, and you can come in at any time with a youth ages 12 to 17 in crisis. They will see a therapist within the first 30 minutes of being in the building. And then we also simultaneously opened our inpatient unit. So if we can't make a safe discharge home, or if we can't provide them the services in the first few hours, we do have that ability to move them into our inpatient unit. So again, I wanted just to say thank you so much to the state and all of your guys' help, and making this come to fruition for both Megan and I. It has been our passion for, the last couple of years trying to get this going, and it's finally there and we are open. So I hope this serves as a resource for our community and anybody that needs it. And if you have questions or need anything, please don't hesitate to reach out. We're happy to answer any questions.
Wow. Thank you, Janelle, and thank you, Megan. What excellent news to end on, and I'm so appreciative. Janelle, I know you're a formal working group representative member here, and you've been along for every step of this journey. So thank you for hearing that feedback last October and acting on it so quickly. And I know that this is a product of incredible amount of work and the back end details to try to figure out how best to create this model. So thank you for all you're doing, and we look forward to hearing how this new service goes and how our community can continue to engage with it. So I really appreciate that and warms my heart. So thank you for sharing. All right. With that, let's move to our final slides here. We will open it up for a public comment period. Again, feel free to raise your hand, come off mute, share your name for the record. Again, these items should be raised related to something on the agenda today, but that's pretty broad. So we welcome your public comment before we close. Any public comment here? Okay. Well, with that, I will close a little bit early. So I hope you all enjoy your evenings. I wish you a restful and peaceful holiday season. We will be here through the end of this year, of course, so please don't hesitate to reach out to us at any time. We look forward to sharing updates with our listserv as well. I hope to have some updates related to those rate approvals and other key items from CMS. So stay tuned on our listserv for more updates. But in the meantime, we look forward to formally reconvening this group in January. And just want to thank you for your time and energy and passion for this work. So thank you again and have a lovely rest of your evening.